Hi everyone, this is Jane Miller. I'm the owner of ALTA Physical Therapy and Pilates, and I just want to let you know what's happening at ALTA in light of the global pandemic. In one way or another, we are all hurting financially, emotionally, and very often physically. We know from pain science that increased threat often means that our body starts to hurt more, and that's because it's trying to alert us to potential danger. And who right now does not feel more danger? So that means that latent symptoms that you've had before can reappear, or you can have a new injury that you've never experienced before, all of which could be a part of the increased stress of what's happening in our world right now. So, physical therapy is considered an essential service, and that's because we are here to help you recover from pain and stay away from the emergency room, from urgent care, or from anywhere where there may be more people who are ill. If you have a musculoskeletal issue, we can help you in a variety of ways. If it's an acute problem, a new problem, it might be that you'd need to come into the office for us to see what's going on. And we certainly can do that. And in the office, let me just say, we have made a bunch of changes to keep everyone safe. We are seeing patients only one every 15 minutes, so you don't wait in the waiting room. You go right back to a treatment room. You only see your therapist. Your therapist will be wearing a mask and gloves if necessary, and we will be disinfecting every room between visits to make sure that as much as possible everyone stays safe. But if you're somebody who has a health condition that puts you at increased risk, if you've been in contact with somebody that has the virus, or if you're sick, we don't want you to come in. It's not good for you, and it's not good for us. So we're here to talk about some options in that situation. And one of the options we have is telehealth. We have a pretty neat system set up. All you need is a computer or a smartphone or a tablet, and we'll send you an invitation. When your scheduled appointment is, you'll click on and you'll see me on one side on your computer screen, and I'll see you on mine. So it's almost like an in-person visit. And if you're a continuing patient, I'll do everything I normally do. I'll catch up with how things are gone since the last visit, what's hurting, what's not, talk about what makes you feel better, what makes you feel worse, which exercises help, which ones might need tweaking. So we'll talk about all the things that we normally do in a visit. Then I'll probably ask you to move. And there's a lot I can tell from watching you move. So for example, if you have a shoulder problem, this might be how it goes. I ask you to stand up and step away from your computer so I can see you. And just like this, what I do is ask you to say it's a shoulder problem. Okay, can you lift your arms up overhead? What does that feel like? I'll ask you to move in a variety of ways. I might ask you to resist a movement so I can see exactly what's going on. And then I have you turn around and check what happens when you internally rotate your shoulder. I might ask you to reach this way. I'm going to ask you to reach across your body and then compare it to the arm that doesn't hurt and see how that feels and what the range of motion looks like. I'll also probably clear your neck. We call it clearing your neck, and that means I'll ask you to look down to either side and go through normal ranges of motion in your neck to make sure that that is not part of the shoulder problem. So once I have a pretty good idea of what's going on, and all the while you're giving me feedback, then we're going to talk about what to do. And there are a variety of things. A lot of what we do in physical therapy is education. So I'm going to show you ways to move, ways to position yourself, what to do with maybe heat or ice to help decrease your symptoms. We'll talk about Exercises. There are lots of exercises that can help you move more comfortably. And we might review what you're doing now and modify or update, problem solve through all that. And because you're at home, the cool thing is I can have you take your computer to your workstation and we can look at how you're moving and how you're using your workstation, if in fact you're working from home, to see what we can do to modify things. We'll talk about how you're sleeping, what positions, what pillows you can use, and then with the exercises, we might use things that you already have at home. A wall, for example, to push against if you need to strengthen. There are a variety of ways we can get creative and help you get the exercises you need to improve. So between education and exercise, there's a whole bunch we can do in physical therapy remotely. And we would ask you to call our office and schedule that appointment. Physical therapists are experts in musculoskeletal health, and we're perfectly capable of doing a screen to evaluate whether or not you need to go back to see your doctor. In most cases, we don't need a physician's referral for you to see us for that initial evaluation and for ongoing treatment. Our goal is to keep you healthy without you losing any ground on your rehab. So call us at 303-444-8707 and we'll get you the help you need. Thank you.